What exactly was the promise of the electronic medical record? Physicians were told EMRs would improve workflow, improve the quality of care, improve patient safety, but as we look around the country, do we really feel like this is the case? Sure, there have been some benefits along the way, such as greater access to patient records between the acute care and outpatient environments. But the clinical applications that physicians work on daily are far too cumbersome, inefficient, and they're actually a key contributing factor to physician burnout. In fact, a recent study by the RAND Corporation revealed that 27% of physicians are definitely burning out, and 22% say they'll definitely quit their practice or change careers in the next 2 years. So, what do? How do we solve this problem? Well, fortunately, recent IT advancements with interoperability protocols are actually paving the way for new clinical applications to live inside of all major EHR systems. That's right, hospital systems can keep their existing enterprise EHR, and physicians can finally work on a documentation system that aligns with their workflow and supports their practice. There is a new day. There is a new solution, and it's called Medical Professor. Developed by a team of clinical workflow experts, billing and coding experts, and the leading clinical risk management and patient safety organization in the country, Medical Professor is a revolutionary clinical application that streamlines provider workflow, alleviates physician frustration, improves quality, and protects patients and clinicians against adverse events and litigation. In addition to the chief complaint-specific structured templates, the user interface gives providers plenty of flexibility to tailor the narrative through dictation or free text areas. The intuitive design Medical Professor allows providers to work quickly through the various sections of the medical record, pulls through documented findings from previous sections, and helps safeguard against contradictory or fraudulent statements. As providers are documenting, the RSQ Watch is tracking the compliance with important high-risk elements that have historically led to adverse events and litigation. Knowing that certain documentation elements that are so often associated with a particular condition, Medical Professor provides passive notification to physicians about the possibility of a serious medical condition with immediate access to an entire clinical decision support library. And for the first time in your medical career, you'll be working on a decision-making section that was so intelligently programmed that it actually facilitates the practice and documentation of evidence-based medicine in response to high-risk conditions that you've identified in your differential diagnosis. Many other features related to billing and coding and general workflow efficiencies make Medical Professor the most complete and innovative application built by medical professionals for medical professionals. The time for positive change has come. You and your patients deserve better. Add Medical Professor to your EMR. Improve your workflow and improve patient safety.